Summer's here, 90 degrees and all. We're in the second full day of summer. And while we all want to have fun in the sun, we need to make sure we are prepared for anything to happen. And today's To Your Wellbeing, we're talking summer first aid and injury prevention kits. Dr. Philip Lamptey joins us. He is Cone Health's Urgent Care Division Medical Director. Let's first talk about summer first aid kits. We need to be prepared just in case. What do we need to include in these things?
The first aid kits are sold by most of the retail shops around us, and so I would advise that with summer coming through, everybody needs to get one. But these first aid kits usually have assorted bandages, compression gauzes, antibiotic and antiseptic wipes and ointments, gloves, tweezers, thermometers, and emergency first aid guide, which is very helpful in dealing with minor injuries and illnesses that we commonly face in summer.
Definitely need to make sure you put it in a place in the house where you know where it is too. It seems like we can never find ours when we need it.
Yes, and just make sure that every 6 months to a year you look through and see what you're low on, and then you replenish it. But typically about 2 to 5 years, you need to change your whole first aid kit and get a new one.
And is that because stuff expires? Will it just not work anymore?
Some of them is that you use them, so you don't have enough of them. Others expire, and some of them, they don't expire, so you just have them for a long time.
So first aid kits are great responding to stuff, but what if you don't have what you need in there? When do you need additional help, like going to the urgent care?
So if you don't have enough stuff in your first aid kit, or your emergency first aid guide does not give you good information as to what to do with the injury or medical condition you're facing, that is the time that you would need to seek professional help to help deal with the injury or medical condition that you're facing.
And do you have to go straight to the emergency care or ER? Are there other options?
There are other options. The first option I'll talk about is using your smartphones to virtually access the urgent care providers. And you can do that going through our website. You click on a link, and then it lands you into a virtual consulting room where you will talk to a provider, and they will address your issues for you when you talk to them. The second option is if you prefer to go in person. We have several urgent care sites right from Candaceville all through to the Alamance County. So you can go to any of them, and you will be taken care of by one of our providers in the urgent care. If your condition is one that is life-threatening, then the emergency room is a place to go.
Of course, we all hope to avoid that. What can we do to prevent some of these summer injuries in the first place?
So you will need to basically have a few things that helps prevent some of the common injuries. Having like a sunscreen and wearing a hat helps with sunburn, and also in the long term helps prevent skin cancers. Having a bug spray would help reduce chances that you'll be bitten by a mosquito or a tick or another insect. And wearing protective eyewear if you're doing yard work is also very helpful in preventing eye injuries. For our kids and people who like to ride their bikes, wearing helmets all the time help prevent head injuries. And of course, we are in a pandemic, so always remember to wear your mask. Always remember to have hand sanitizers in areas where you may not have access to soap and water.
Yeah, speaking of the pandemic, how does COVID change things this year? Are you worried about it impacting any summer activities?
We still have COVID in our community, and not everybody is vaccinated at this time. So for those who are vaccinated, they pretty much don't need masking, especially when they are outdoors, except if they find themselves in large crowds, then masks are recommended. On the indoor front, they need to wear their mask if they are with a large crowd of people, and some of them are not vaccinated. For those who are not vaccinated, I always say that I recommend get vaccinated. It protects you, your family, your friends, and it also frees you up to do the things that you like to do. If you are not vaccinated and you are outdoors with a large group of people, you need to have a mask on, If you are indoors, you need to have your mask on. And just make sure that when you're attending places where there are large crowds, you have your mask on. For our younger kids who are 12 and under, we should always make sure that they have their mask on. For those who are 2 to 12-year-old, under 2-year-old they typically will not leave the mask on, and we don't recommend them having the mask on.
When the vaccines first came out, a lot of people who were hesitant about them said, you know, I'm going to wait a while, see how it impacts everyone else first and make sure there's no side effects. Have you seen any reasons why people should not get vaccinated?
And I get these questions a lot in the urgent cares. And what I tell people is that we've had over 100 million or so doses of the vaccine given. And if there was a very serious side effect, some of it will be apparent by now. And so I tell them that, you know, we've waited for 100 million shots. How long do we want to wait, to get vaccinated? And I encourage people to really get vaccinated because these vaccines are safe, they're effective, and it really frees you up to get your life back.
And definitely can help us enjoy this summer for sure. Thank you so much, sir. We appreciate your time. If you want any more information about this, you can find all those summer first aid kit tips on WFMYnews2.com. We'll be right back.